Welcome back. Dr. Kristen Simpson from Simpson Dental joins us today to talk about some common questions about cosmetic dentistry. Thanks for joining us.
Yes.
So
thanks for having me.
What are the common questions you hear about cosmetic dentistry?
Well, you know, things are constantly changing with dentistry with all the advances, so there are better ways to get a smile makeover. So we'll go over some of the most common things that we do with patients to brighten up their smile and get their teeth looking better. So the first thing that most people ask us about is whitening. So whitening is a great way to just freshen up your smile and whiten those teeth, and we use Zoom whitening. Zoom is a great way to get 5 to 6 shades lighter while you're in the office, and we give you take-home trays to be able to maintain the shade that you get while you're in the office. So that's a great, quick, and easy thing to do to just freshen up your smile.
Okay. What is the best way to straighten teeth? Because I've noticed as we get a little older, they shift a little bit.
They sure do. A lot of times those lower front teeth will get crowded. So Invisalign is a great way to straighten teeth. They're clear aligners that can move teeth. And actually, I'm wearing Invisalign right now. So you can't tell. You can't even tell people are wearing them. You wear the aligners for about 2 weeks, and then you change to a new set.
Oh, that's nice. Yeah, we can't even see that you have them in. Talk about what veneers do. How can a veneer help?
So, yeah, veneers are a thin layer of porcelain. They'll cover the front and the edge of the tooth, so it's a good way if you have some worn enamel that you need to replace that missing enamel. A veneer can do that. It can even up the color of the teeth, and it can kind of do minor straightening of the teeth as well. So it can really help to even up the smile line and make all the colors blend better.
Okay. How can crowns help our teeth?
So crowns are if a tooth is a little bit more broken down, if you have like a filling already in the tooth or part of the tooth is chipped, or if you have very large spaces in between the teeth, a crown will be the best way to cover up that tooth, support the tooth, and either fill in spaces or add back missing tooth structure. So it's like a cap that covers the whole tooth.
Okay. How do we keep from wearing down our teeth?
So wear normally happens either at night when you're sleeping or during the day if you're stressed from clenching and grinding your teeth. So first thing, you want to protect your teeth from that wear. You can use some type of splint or something to cover those teeth and protect them. If you want to replace that missing enamel, you can do it with either veneers or crowns.
Okay. What are some of the causes of sensitivity along the gum line?
So a lot of time that's the common spot to get sensitivity, and it's if you have a little bit of recession in the area and you have exposed root structure. The root structure is a lot more sensitive than the enamel, so that's where people notice the hot and cold sensitivity. So you can use like sensitivity toothpaste or get a fluoride treatment from your dentist.
Okay, and is gum recession fixable?
It is, yes. So gum recession can be caused, of course, from brushing too hard or because of an improper bite. If you're biting in a weird direction on a tooth, it can cause the gums to recede. So you first want to address those things. Make sure you're using a soft bristled toothbrush, get your bite corrected, and then the gums can either be added back with grafting, or if it's just sensitivity in the area, you might just do like a filling or something to cover that area.
Okay. And finally, talk to us about implants. We hear ads about them all the time. People are always talking about getting implants. How natural can they be made to look?
Implants look very natural. It's actually the best way to replace a missing tooth. It preserves the bone in the area and also replaces the crown of the tooth. So once that's done, it functions just like a natural tooth. So it's really the best thing to do, most natural and lifelike looking restoration to do for missing teeth.
Oh, that's great. Lots of options there. Dr. Simpson, thanks so much for talking with us today.
Sure, thanks for having me.